This is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about Bell's palsy. Bell's palsy is a disorder of the nerve that controls the movement of the muscles in the face. Damage to this nerve causes weakness or paralysis of these muscles. Bell's palsy affects about 30,000 to 40,000 people a year in the United States. Bell's palsy involves damage to the seventh cranial, also called the facial nerve. This nerve controls the movement of the muscles of the face. Here are some pictures of what the patient looks like when they have Bell's palsy. The most important thing is the weakness is of the whole face, including above the eyebrow. Causes of Bell's palsy include herpes zoster, HIV, Lyme disease, middle ear infections, even sarcoidosis. Bell's palsy is caused to be swelling or inflammation of the nerve, the facial nerve, as it travels through the bones of the skull. And like I mentioned, it could be caused mostly by viral inflammation of the nerve. Sometimes you may have a cold shortly before the symptoms of Bell's palsy begin. Symptoms most often start suddenly, but may take 2 to 3 days to show up. They do not become more severe after that. Symptoms are almost always in one side only. They may range from mild to severe. The face will feel stiff or pulled towards the one side and may look different. Other symptoms include difficulty eating and drinking. Food can fall through one side of the mouth. Drooling because of the lack of control of the muscles of the face. Drooping of the face such as the eyelid or corner of the mouth. Hard to close the one eye. Problems smiling, grimacing, or making facial expressions. Twitching or weakness of the muscles in the face. Other symptoms may include dry eye or mouth, headache, loss of sense of taste, sound that is louder in one ear or hyperacusis, and twitching of the face. Often, Bell's palsy can be diagnosed just by taking a health history and doing a complete exam. No blood work or CAT scans are necessary for most cases. If the provider has any doubt or wants to rule out other causes of Bell's palsy, he might do a CT scan of the head, an MRI of the head, sometimes an EMG or electromyography, and nerve conduction studies. Often no treatment is needed. Symptoms often begin to improve right away. However, it may take weeks, even months, for the muscles to get stronger. This will be very frustrating. Your healthcare provider may give you lubricating eye drops or eye ointments to keep the surface of the eye moist if you cannot close your eyelid completely. You may need to wear an eye patch while you sleep. Sometimes medications may be used, but it is not clear how much they will help. If medicines are used, they should be started right away. Corticosteroids may reduce the swelling on the facial nerve, and medications that fight the virus that may be causing Bell's palsy, for example, antivirals. Surgery is sometimes done to relieve the pressure on the nerve, a decompression surgery. It is controversial and has not been shown to be routinely benefit to people with Bell's palsy. Prognosis. Most cases go away completely within a few weeks to months. If you do not lose all your nerve function and symptoms begin to improve within 3 weeks, you're more likely to regain all or most of your strength of the facial muscles. Chronic symptoms. Sometimes the following symptoms may be present: long-term changes in taste, spasms of the muscles or eyelids, and weakness that remains in the facial muscles. Complications include excess drying of one eye surface leading to eye ulcers and infections. Make sure that you tape or patch your eye at night so that this doesn't happen. Follow-up. Call your healthcare provider right away if your face droops or you have other symptoms of Bell's palsy. Your healthcare provider cannot be sure by exam alone. He'll probably refer you to an emergency department for further evaluation. Other conditions that must be ruled out are strokes. If you have unilateral body weakness, mentation changes, fever, chills, nausea, vomiting, any new or any progressive or worsening symptom, you should come back to the emergency department. For more videos like this video, please go to edxitvideo.com. But remember, these are educational videos and should never replace the care or attention of a medical professional. Please take a moment to like the video and to subscribe to my channel. Thank you.